What would happen if most commonly prescribed medications were given to people who needed them free of charge? You might think it would be too expensive, but researchers found the exact opposite.
I was surprised by the magnitude of the savings. Savings of around $1,000 per patient per year.
A newly published trial followed nearly 750 patients in Ontario for 3 years. About half of them got their prescriptions as usual, paying out of pocket or using public or private insurance. The other half received their prescriptions at no cost. Researchers then tracked spending on appointments with doctors, specialists, emergency room visits, and hospitalizations. They found patients in the free medication group reduced healthcare spending by nearly $1,500 per patient.
Putting it all together, it seems like eliminating medication costs both saves money in avoided hospitalizations, avoided emergency room visits, makes people healthier, and it makes access to health more fair.
Every country with universal health care includes universal pharmacare or drug coverage, except Canada. Data shows 1 in 4 Canadians is struggling to pay for medications.
Looking after people is very much like looking after a house. You gotta deal with all the maintenance, and if you don't, you end up with huge expenses which you weren't planning on.
Economics experts say universal coverage would reduce financial pressures on Canadians and crowded emergency rooms.
So I think that's going to be pretty convincing for governments.
The federal government first promised universal pharmacare in 2015. Canada's health minister says they're still working on it.
We look forward to make more progress with more provinces and territories in the years to come.
I am terrified.
Marielle Ritchie needs help now. She's aging out of public coverage in Ontario. This is her last no-cost prescription.
What's happened before is that I have split up how much I'm actually supposed to take daily, which is highly discouraged.
Christine, the federal government has been talking about universal drug coverage for 8 years now. What are the obstacles?
Yeah, Canadians are paying some of the highest drug prices in the world. There is a drug price review board that's been working on reducing prices. Members of that board have argued the health minister is getting in the way. When I spoke with the minister, he disagrees, adding there's a pilot project happening in PEI right now that may be expanded. But doctors also say the pharmaceutical industry and private insurance companies are lobbying governments against making changes. At the same time, we spoke with so many patients today who said this shouldn't be about dollars and cents. It should be about the health of Canadians. And right now, there are so many people who simply can't afford their medications and they're struggling.
Thanks, Christine.
You're welcome.